Let me tell you something that may surprise you. If you're over 75 and you start stretching every single day, touching your toes, pulling your arms across your chest, gently turning your neck, but you're still stiff, still losing balance, still feeling weaker every month, stretching alone is not enough. And today I'm going to explain exactly why and what you must start doing instead to protect your joints, your muscles, and your independence. Because after 75, your body plays by different rules. If you wake up stiff, if your back feels tight, if your hips don't move the way they used to, the natural reaction is to stretch. You bend forward, you pull your arm across your chest, you rotate your neck slowly from side to side, and for a few moments it feels good. It feels like you're doing something healthy. But here sits the truth. After 75, stiffness is rarely just a flexibility problem. It's a muscle loss problem. As we age, the body naturally goes through a process called sarcopenia, age-related muscle loss. Starting in our 30s, we lose small amounts of muscle every year. But after 70, and especially after 75, that loss accelerates. The fast twitch muscle fibers, the ones responsible for strength, balance, and quick reactions, shrink dramatically. Now think about what that means. Muscle is what supports your joints. Muscle is what keeps your knees aligned. Muscle is what stabilizes your hips. Muscle is what protects your spine. When muscle weakens, joints lose support. When joints lose support, they become unstable. And when joints become unstable, the body responds with tightness. That tightness you feel in the morning is often your body trying to protect a weak area. It's not simply short muscles. It's your nervous system tightening tissues to create stability because the muscles are no longer strong enough to provide it. So you stretch, and temporarily it feels looser, but you haven't solved the real problem. In fact, if you stretch a joint that's already unstable without strengthening the muscles around it, you can make it even less stable. It's like loosening the bolts on a chair that already wobbles. It may feel more flexible, but it's not more secure. This is why many seniors stretch every single day, sometimes for years, and still struggle to stand up from a low chair. Still struggle climbing stairs, still feel unsteady walking across a parking lot. Flexibility does not equal strength. And after 75, strength is the foundation of everything. Let's talk about why muscle loss changes everything. Muscle is metabolically active tissue. It helps regulate blood sugar. It supports bone density. It keeps circulation strong. When muscle mass decreases, not only do you feel weaker, but your joints absorb more stress. The cartilage in your knees and hips must handle more load because the surrounding muscles aren't absorbing force like they used to. This often leads to more discomfort, more stiffness, and more fear of movement. And fear of movement leads to less movement. Less movement leads to more muscle loss. It becomes a cycle. Now here's something powerful. Your body does not lose the ability to build muscle after 75. It loses muscle because it's not being challenged. Even at 80, even at 85, muscles can respond to resistance. The nervous system can adapt. Strength can improve. But stretching alone does not provide enough stimulus to trigger that adaptation. When you stretch, you stir lengthening tissue temporarily. When you perform controlled resistance, even something as simple as standing up from a chair slowly and sitting back down, you start telling your brain and muscles, we still need this strength. And the body listens. Another important point is muscle fibers shrink with age. The communication between the brain and muscles slows down. Reaction time decreases. That's one reason falls become more common after 75. Stretching does not retrain that communication. Strength training and balance exercises do. You see, stiffness is often a symptom of underused muscles, not over-tight muscles. Imagine you had your arm in a sling for 6 weeks. When you take it out, it feels stiff. But is it stiff because it's too tight or because it's weak and deconditioned? It's just weak. The same thing happens gradually over years when we move less, sit more, and rely only on light stretching instead of strength-building movement. And here's another critical piece. Ligaments and tendons also change with age. They lose elasticity and become less resilient. If you aggressively stretch weakened connective tissue without strengthening the surrounding muscles, you risk increasing joint laxity that can contribute to pain, inflammation, and instability. So when someone says, I stretch every day, but I'm still stiff, the question becomes, are you strengthening? Because without strength, flexibility has no anchor. Think of flexibility as range. Think of strength as control. Range without control is vulnerability. After 75, the goal is not to become more flexible than ever before. The goal is to become more stable, more confident, more capable in daily activities. That means being able to rise from a chair without using your hands, being able to step onto a curb without hesitation, being able to turn your body safely when someone calls your name. Stretching may feel productive because it's gentle and familiar, but it does not reverse sarcopenia. It does not rebuild the fast twitch fibers responsible for preventing a fall. It does not significantly improve bone density. It does not train coordination. And here's something encouraging. It does not take heavy weights or intense workouts to stimulate improvement. Even light resistance done consistently sends a powerful signal to aging muscles. The key message is this. After 75, stiffness is often your body asking for strength, not more stretching. When you address the true cause, muscle weakness and joint instability, the feeling of tightness often decreases naturally. Movement becomes smoother. Confidence returns. Fear diminishes. Stretching still has value. It improves circulation. It can relax tense areas. It can feel wonderful at the end of a session. But it should not be the foundation. The foundation must be strength. Because strength supports flexibility, strength protects joints, strength preserves independence. Let's talk about something that becomes absolutely critical after the age of 75. Strength, not bodybuilding, not lifting heavy barbells, not pushing your body to exhaustion. I'm talking about gentle, controlled resistance that rebuilds what time is slowly taken away. Because here's the truth, after 75, your joints are only as safe as the muscles surrounding them. Every joint in your body, your knees, hips, shoulders, spine, depends on muscle for protection. Bones stack on bones, but they don't stabilize themselves. Ligaments help, yes. Tendons connect muscle to bone, yes. But muscle is the active support system. Muscle absorbs shock. Muscle controls movement. Muscle keeps alignment in check. When muscle weakens, joints take the hit. And after 75, muscle loss accelerates unless you deliberately challenge it. Think about your knees. When the quadriceps, the large muscles on the front of your thighs, weaken, your knees absorb more stress with every step. Cartilage experiences more compression, inflammation increases, you may feel stiffness or discomfort. The natural response is to move less. Moving less weakens the muscles even more. Now your hips. The gluteal muscles are some of the most important muscles for stability and balance. When they weaken, your pelvis becomes less stable. That affects your lower back. It affects your walking pattern. It increases fall risk. And here's what most people don't realize. Weak muscles make joints feel tight. It sounds backwards, but it's true. When muscles aren't strong enough to stabilize a joint, the nervous system creates protective tension. That tension feels like stiffness. So people stretch, but stretching without strengthening doesn't solve the instability underneath. Strength is the solution. And here's the encouraging part. You don't need heavy weights to build strength after 75. Your body weight is enough. Gravity is enough. Consistency is enough. Let's start with one of the most powerful exercises you can do, the sit to stand. Sitting in a chair and standing up without using your hands trains the quadriceps, glutes, and core. It directly improves your ability to get up from the toilet, from the couch, from a restaurant chair. That's functional strength, that's independence. And when you perform that movement slowly and with control, you're not just strengthening muscle, you're training coordination between your brain and body. That neural connection is critical after 75. Another simple example, wall push-ups. Placing your hands against the wall and slowly lowering your chest toward it strengthens the chest, shoulders, and arms. Why does that matter? Because pushing strength is what allows you to catch yourself if you stumble. It allows you to push open heavy doors. It allows you to support yourself when getting out of bed. Strength equals safety. Now let's talk about heel raises. Holding onto a chair and lifting your heels off the ground strengthens the calf muscles. Those muscles are essential for walking stability. They help propel you forward. They help you react quickly if you trip. Weak calves mean slower reactions. Slower reactions increase fall risk. You see how everything connects? Muscle is not just about appearance, it's about survival. After 75, falls are one of the greatest threats to independence. A single fall can lead to fractures. Fractures can lead to surgery. Surgery can lead to prolonged bed rest. And prolonged bed rest causes rapid muscle loss, sometimes shocking amounts in just days. Strength training is fall prevention, and it's never too late. Research consistently shows that even individuals in their 80s and 90s can gain measurable strength from light resistance training. The body remains adaptable. The muscle fibers may shrink with age, but they are not gone. They are waiting for a signal. Resistance is that signal. When you gently challenge a muscle, you create microscopic stress within it. The body responds by repairing and strengthening that tissue. That process improves stability around the joint, and stable joints feel better. Many people notice that when they begin strengthening regularly, joint discomfort decreases. Not because cartilage magically regrows, but because muscles are absorbing more load. Alignment improves. Movement becomes smoother. Another powerful benefit, bone density. Bones respond to stress just like muscles do. When muscles contract against bone, they stimulate bone cells to maintain density. That's crucial after 75, when osteoporosis becomes more common. Stretching does not stimulate bone, resistance does. And let me emphasize something important. This is not about intensity, it's about control. Slow movements are incredibly powerful. Lowering yourself into a chair over 5 seconds builds more strength than quickly dropping down. Moving slowly increases time under tension. That increases muscle activation. Quality over quantity. 2 sets of 8, 12 controlled repetitions of a simple movement can be more effective than 50 fast, careless ones. And consistency matters more than duration. 10 minutes a day of focused resistance work can produce life-changing results over months. Because strength builds gradually, it builds confidence, it builds posture, it builds resilience. Now imagine walking into a room and feeling steady, climbing stairs without hesitation, standing up without pushing off your thighs. That feeling is not flexibility. That feeling is strength. And strength sends a powerful message to your brain. We are capable. That psychological shift is just as important as the physical one. When people feel stronger, they move more. When they move more, circulation improves, mood improves, sleep improves, energy improves. This is a ripple effect. But it begins with one decision to challenge your muscles gently and consistently. Let me say this clearly, after 75, stretching alone will not protect your joints. Strength is what keeps your knees aligned when you step off a curb. Strength is what protects your spine when you lift groceries. Strength is what keeps your shoulders stable when you reach overhead. Strength is joint insurance, and you don't need expensive equipment. You don't need a gym membership. You don't need to compare yourself to anyone. You simply need to move with intention. Controlled resistance, slow and steady, day after day, because muscle is medicine. And after 75, that medicine becomes essential for maintaining independence, preventing falls, protecting bones, and living confidently. You are not too old to get stronger. Your body is waiting for the signal. Give it that signal and it will respond. There is something that becomes more important than flexibility, more important than even strength alone after the age of 75. Balance, because balance is what keeps you upright. Balance is what keeps you independent. Balance is what prevents a single misstep from changing your life. Let me explain something very clearly. Falls are not random accidents. In most cases, they are the result of declining balance, slower reaction time, weaker stabilizing muscles, and reduced communication between the brain and body. And here sits what most people don't realize. Balance is a skill. And like any skill, if you don't practice it, you lose it. After 75, several systems in the body begin to decline. The inner ear, which helps control equilibrium, becomes less sensitive. Vision may not be as sharp. The small stabilizing muscles in the feet and ankles weaken. Nerve conduction slows down. The brain takes longer to process changes in position. All these factors combine to make you less steady. Stretching does not retrain these systems. Strength training helps, but without balance-specific practice, the nervous system does not fully adapt. You must train balance directly. Now here's the encouraging news. Balance improves with practice at any age. Even in your late 70s, even in your 80s, even in your 90s. Your nervous system remains adaptable, but you have to challenge it. Let's start simple. Standing on one leg. That may sound almost too basic, but try it. Stand near a counter or sturdy chair. Lift one foot slightly off the ground. Hold for 10 seconds. Switch sides. At first, you may wobble. That wobbling is not weakness. It is your nervous system waking up. It is your brain recalibrating. Tiny muscles in your feet and ankles are firing rapidly to keep you stable. Those micro adjustments are powerful. They're exactly what prevent a fall when you step on uneven ground. Now think about walking heel to toe across a room, placing one foot directly in front of the other as if you are walking on a straight line. This challenges coordination and stability. It forces your body to control lateral sway. This type of movement strengthens not only muscles but neural pathways, because balance is not just physical, it is neurological. Your brain must constantly interpret signals from your eyes, your inner ear, your joints, and your muscles. It must decide how to respond in milliseconds. When you practice balance daily, you sharpen that communication, and sharper communication means faster reaction time. Reaction time is everything after 75. If you trip over a rug, the difference between falling and catching yourself is often a fraction of a second. That fraction depends on how quickly your muscles respond. If you never challenge your balance, those response times slow down. Now let's talk about fear. Many seniors stop challenging their balance because they are afraid of falling. That fear is understandable, but avoiding balance challenges actually increases fall risk. When you avoid uneven surfaces, avoid stairs, avoid narrow walkways, your nervous system becomes less adaptable. It becomes overly cautious. Muscles stiffen. Movements become rigid. And rigid movement patterns increase instability. Instead, we must safely challenge balance in controlled ways. Holding onto a countertop while marching slowly in place is an excellent example. Lift one knee, pause, lower it slowly, alternate sides. This improves single leg stability and coordination. Or try gently shifting your weight side to side while standing. Feel the pressure move from one foot to the other. That teaches your body to control lateral motion, which is where many falls occur. Another powerful exercise is practicing controlled turns. Slowly rotate your body 180 degrees and pause. Turning is one of the most common triggers for dizziness or imbalance. Training it improves confidence. You see, balance is dynamic. It is not just standing still. It is walking, turning, reaching, stepping, reacting. After 75, daily balance practice should become as routine as brushing your teeth. 3 to 5 minutes a day can dramatically improve stability over time. And here's something very important. Balance training also improves posture. When you stand on one leg, your core muscles activate, your spine aligns, your hips stabilize. Over time, this reduces forward stooping and improves walking mechanics. Better posture means better breathing. Better breathing means better oxygenation. Everything is connected. Now let's address something else. The feet. Your feet contain thousands of nerve endings that send information to your brain about ground position. When the small intrinsic muscles of the feet weaken, stability decreases. Simple exercises like standing barefoot on a safe surface and gently gripping the floor with your toes can strengthen these small muscles. Strong feet create a stable foundation. And remember, the goal is not perfection. The goal is improvement. You may not feel steady at first. That is normal. Progress might look like holding one leg for 5 seconds instead of 3, or walking heel to toe without stepping out of line. These small improvements add up. Confidence grows, and confidence changes everything, because when you feel steady, you move more freely. When you move more freely, you maintain muscle. When you maintain muscle, you protect your joints, and the cycle becomes positive instead of negative. Balance training also stimulates cognitive function. It requires focus. It requires awareness. Studies show that physical coordination tasks activate brain regions responsible for memory and attention. So when you train balance, you are also training your brain. Now let me be clear, always practice safely. Stand near a stable object. Avoid slippery surfaces. If you have severe dizziness or medical conditions affecting balance, consult your healthcare provider before starting. Safety first. But do not avoid balance training out of fear. Avoiding it is far more dangerous. After 75, balance is not automatic. It must be practiced intentionally. And the beautiful thing is this, the body responds quickly to balance challenges. Improvements can be noticed within weeks. Walking feels steadier. Turning feels smoother. Fear decreases. That reduction in fear may be the most powerful benefit of all, because fear restricts life. Confidence expands it. Balance training is not about becoming an athlete. It is about protecting your independence. It is about preventing that one fall that could change everything. It is about telling your nervous system, stay sharp, stay responsive, stay ready, and your body will respond. Every day you practice, you are investing in your stability. You are investing in your safety. You are investing in your freedom. And after 75, that investment is priceless. Let me share something that truly changes the way we think about exercise after 75. It's not about how much you can lift. It's just not about how far you can stretch. It's about how well you can live your daily life. That's where functional movement comes in. Functional movement means training your body to perform the exact actions you use every single day safely, confidently, and without strain. Because after 75, independence is built on simple movements. Getting out of a chair, reaching into a cabinet, turning to look behind you, stepping onto a curb, bending to pick something up. These are not gym exercises. These are life exercises. If you don't practice them, your body slowly loses the ability to perform them efficiently. Here's what happens as we age. We move less, we simplify tasks, we avoid bending down because it feels uncomfortable, we stop getting on the floor because it feels difficult to get back up, we ask someone else to lift heavier items. It feels harmless at first, but the body adapts to what it does and what it doesn't do. If you stop rotating your spine regularly, it stiffens. If you stop squatting, your hips lose mobility and strength. If you stop reaching overhead, your shoulders weaken and tighten. And slowly, everyday movements begin to feel like challenges. That's why functional movement training is so powerful. It teaches your body to stay capable in real-world situations. Let's start with one of the most important movements, getting up and down from a chair. This movement trains your legs, hips, and core together. It mimics one of the most frequent daily actions you perform. Practicing it slowly and with control strengthens the exact muscles needed for independence. Now think about reaching overhead. How often do you reach into a cabinet? How often do you place something on a shelf? If you never train that motion, the shoulders weaken, the upper back rounds forward, posture declines. That rounded posture shifts your center of gravity forward, increasing fall risk. But when you practice controlled overhead reaching, even with a light object like a small water bottle, you strengthen the shoulders and upper back, you maintain joint mobility, you reinforce proper posture. Posture is not cosmetic. It's the structural stability. The more upright you stand, the better your balance and breathing. Another essential functional movement is safe squatting. Now, I'm not talking about deep athletic squats. I'm talking about partial squats while holding on to a sturdy surface, lowering your body slightly and returning to standing. This trains your hips and knees in a coordinated way. It prepares you for tasks like sitting down, getting into a car, or bending to reach something. When you practice these patterns regularly, your brain recognizes them as necessary skills and maintains the neural pathways required to perform them smoothly. That brain-body connection is everything after 75. Movement is not just muscular, it's neurological. When you practice real-life patterns, you strengthen communication between your nervous system and your muscles. You improve coordination, you improve timing, you improve reaction. And here's something powerful. Functional movement builds confidence. Many seniors avoid certain actions because they fear losing balance or feeling pain. That avoidance leads to more weakness, increases fear. It becomes a cycle, but when you practice those movements in a controlled environment, fear decreases. Your body remembers how to move. For example, practicing getting safely down to the floor and back up again with support nearby can be life-changing. Why? Because one of the biggest fears after 75 is falling and not being able to get up. When you train that movement intentionally, you remove that fear, you restore capability. Let's talk about rotation. Turning your torso gently while standing strengthens the muscles along the spine and abdomen. It keeps the spine mobile. It prepares you for simple daily tasks like looking over your shoulder while walking or reaching across your body. When rotation disappears, movements become stiff and robotic. That stiffness increases strain on joints. Functional training prevents that. Another overlooked movement is stepping sideways. Most falls occur not from forward motion, but from lateral instability. Practicing small controlled side steps strengthens the hip stabilizers. It prepares you for uneven surfaces or quick adjustments. These movements may seem simple, but simple is powerful because daily life is built on simple actions repeated over and over again. Now here's the key. Functional movement should be slow and intentional. Speed is not the goal. Control is the goal. When you move slowly, you increase muscle activation, you give your brain time to process position, you improve joint awareness. That awareness, called proprioception, declines with age. Functional training restores it. And here's something else to understand. Your body adapts specifically to what you practice. If you only walk, you get better at walking in a straight line. If you practice standing, turning, bending, reaching, stepping, and rising, you become better at living. That's the difference. Functional movement is living practice. It's preparing your body for real life instead of isolating muscles in artificial ways. And you're going to need long sessions. 10 to 15 minutes of targeted functional movement daily can dramatically improve capability over time. Consistency builds resilience. Over weeks and months, you may notice standing feels easier, turning feels smoother, you feel steadier reaching overhead. Getting out of a car requires less effort. That improvement is not accidental, it's adaptation. And here sits the emotional side of it. When you can move freely, you feel independent. When you feel independent, you stay socially engaged. When you stay socially engaged, your mental health improves. Movement is not just physical, it protects quality of life. After 75, the goal is not to perform complex workouts. The goal is to preserve autonomy. Functional movement training tells your body we still need these skills, and the body responds by maintaining strength, coordination, and confidence. Let me say this clearly. If you don't use it, you lose it. But if you practice it, even gently, you preserve it. Your body is incredibly adaptable, even in your later years. It responds to purpose. It responds to repetition. It responds to intention. Functional movement is not about pushing your limits. It's about protecting your life. Every controlled sit to stand, every careful overhead reach, every slow turn of the torso is an investment in your independence. And after 75, independence is priceless. Train for life. Move with purpose. And your body will reward you with strength, stability, and confidence for years to come.